Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Tonsillitis is an infection of the tonsils. Tonsils are two small, round lumps of tissue at the back of your throat. They help your body fight infection. When tonsils get infected, they become inflamed and swollen. Tonsillitis is common in children, but adults can get it too. It is spread through close contact with an infected person. This can happen through coughing or sneezing. It can also happen by sharing drinks or utensils. Tonsillitis is usually not serious. It usually goes away on its own within a week. However, sometimes tonsillitis can lead to complications. These can include difficulty breathing or swallowing. There are three main types of tonsillitis. These are acute tonsillitis, recurrent tonsillitis, and chronic tonsillitis. Acute tonsillitis comes on suddenly. It is the most common type of tonsillitis. It usually lasts for 3 to 4 days, but it can last up to 2 weeks. Recurrent tonsillitis is when you get tonsillitis several times a year. Chronic tonsillitis lasts for a long time. It may be constant, or it may come and go. If you have chronic tonsillitis, your tonsils may be enlarged. You may also have bad breath. Tonsillitis is most often caused by viruses. Many different viruses can cause tonsillitis. The most common are the common cold virus and the flu virus. Bacteria can also cause tonsillitis. The most common bacteria that causes tonsillitis is group A Streptococcus. This is the same bacteria that causes strep throat. Viruses and bacteria that cause tonsillitis are contagious. This means they can spread from person to person. You can get tonsillitis by breathing in the air of someone who is sick. You can also get it by touching something that has the virus or bacteria on it and then touching your mouth or nose. Section 4. Recognizing the symptoms. The symptoms of tonsillitis can vary depending on the cause. However, common symptoms include sore throat, swollen tonsils, difficulty swallowing, fever, headache, and swollen lymph nodes in the neck. A sore throat is usually the first sign of tonsillitis. The pain may be mild at first, but it may get worse over time. It may hurt more to swallow. Swollen tonsils are another common symptom of tonsillitis. The tonsils may be red and inflamed. They may also have white or yellow spots on them. Difficulty swallowing is also common with tonsillitis. This is because the tonsils are swollen. The swelling can make it hard to swallow food and liquids. Section 5. Diagnosis and treatment. Seeing a doctor is important if you think you or your child may have tonsillitis. The doctor will ask about symptoms. They will look at the throat. They may take a throat swab. A throat swab is a test that can help to identify the cause of tonsillitis. To do a throat swab, the doctor will use a cotton swab to collect a sample of mucus from the back of the throat. Treatment for tonsillitis depends on the cause. If the cause is a virus, there is no specific treatment. Treatment focuses on relieving symptoms. If the cause is bacteria, the doctor will prescribe antibiotics. It is important to finish all of the antibiotics, even if you start to feel better. This will help to prevent the infection from returning. Section 6. Prevention and long-term health. Good hygiene is the best way to prevent tonsillitis. This includes washing your hands often with soap and water, especially before eating and after using the bathroom. You should also avoid close contact with people who are sick. If you do get sick, there are things you can do to help prevent spreading the infection to others. This includes covering your mouth and nose when you cough or sneeze. It also includes washing your hands often. Tonsillitis is usually a mild illness. It goes away on its own within a week or two. However, it can sometimes lead to complications, such as a peritonsillar abscess or rheumatic fever. See a doctor if you or your child has a sore throat that does not improve within a few days, or is accompanied by difficulty swallowing, breathing, or a high fever. UMCC, your ultimate medical consultant connector.